passion for teaching to instruct budding physicians and residents. Dr. Lewis is deeply committed to students and has participated on the President's Diversity Council, the University Honors Program, Advisory Committee, and the Division of Professional Practice Advisory Committee, among others. He has worked with UC Foundation to help raise over 1.7 million in endowed scholarships for medical students. Dr. Lewis is also a family doctor for UC Health, where he serves a diverse population of patients and utilizes skills gained at UC to make an impact on community health. Many know Dr. Lewis for his work leading Village Life Outreach Project, a nonprofit organization that partners with 3 rural villages in Tanzania, East Africa, to improve conditions of life, health, and education. He founded Village Life in 2004 after a life-changing global health experience in Tanzania during his medical residency, and has done his best to provide similar transformational experiences to over 600 UC students, residents, and faculty members from a variety of disciplines. The goal of Village Life is to raise awareness and spread love. Dr. Lewis, thank you for being here today to share your expertise and experience with us.
Thank you all for having me. It's been a couple of years at least since I spoke to GlobeMed. I know you all kind of rotate leadership and whatnot every few years, so I am delighted to have this opportunity to speak to you all today about addressing health disparities. And I can come at it from a local or international flavor, but knowing who this group is, I figured I might as well talk a little bit about my work in Tanzania, East Africa, and certainly want to make sure we have time for any questions and answers. I'm really not here to talk at you. I'm here to talk with you and be a resource for providing you the information that you need to make good decisions and to broaden your perspectives and horizons. So thank you again to the leadership for having me. And with that, let's dig in. I want to see if I can share my screen appropriately here. Let's see where we are. All right. Is that currently sharing?
No, it's not.
Not sharing yet. All right.
Yet. No.
Let's see. What can I do on my end? Let's try one more time. So still nothing happening in sharing? How about now?
Oh, there we go.
There we go.
All right. And do you guys see a presenter's view or do you see like notes and things like that, or just a big picture of me?
Big picture of you. Looks good, yeah.
Okay, sounds good. I think one of the most important things to talk about when you're talking about health disparities is always being willing to learn. As many people say, education is a never-ending journey. So I want to talk to you briefly today about my journey, where I'm at in that, what point I'm at in my journey, and where I hope to get in the future. I was fortunate enough to attend UC. I'm a Cincinnati local, Cincinnati native. Grew up here, went to Finneytown High School. Any Finneytown Wildcats in the audience? No? All right. Went away for college, went to Harvard University in Boston, Cambridge, Massachusetts. And it was there that I had my first glimpse of global perspectives. My friends included people from Africa, the Middle East, Asia, different parts of the United States, the West Indies, Caribbean, and different places that I had never been to but wanted to see. So it was my first real chance to have my eyes opened and my mind opened to more global perspectives. I brought those global perspectives back home with me to the College of Medicine. I thought I was going to stay on the East Coast forever, but my mom worked at the university, and at that time they still had tuition remission, so medical school was free. It came back. That's the lovely Care Crawley building, which is the facade of the College of Medicine, and I did 4 years there and really wasn't that good of a medical student. I relied on these folks and many more to get me through medical school. And as you can see from the picture here, there's some diversity there of age, thought, race, gender, and whatnot. And it was really having a wide set of mentors and sponsors that got me through medical school by the skin of my teeth. That's me on graduation day from the College of Medicine back in 2000 with my study partner, Mahmoud Tomlinson. He is now the CEO of multi-state, multidisciplinary multidisciplinary healthcare system. And I think he's one of a handful of Black CEOs of multi-billion-dollar companies. And that's my study partner, Memu Tomlinson. After finishing medical school, and at the time, 96 to 2000, when I was in medical school, global health was a thing, but I didn't know what it was. I thought it meant, oh, this is what I do if I want to train and go live someplace with no running water for the rest of my life. And I definitely didn't want to do that. But upon getting accepted into the UC Family Medicine residency program, which is a 3-year program after medical school, I was asked if I wanted to participate in the global health track. I didn't know what it was, but I said, okay, you all are going to give me a stipend to travel the world and to learn how to do medicine without sophisticated equipment and a whole bunch of expensive medications and the latest, greatest technology. You're going to encourage me to learn medicine where I really have to rely on my ability to listen to patients, to formulate assessments and plans, and rely on my diagnostic skills rather than the multi-million-dollar MRI to figure out what's going on with somebody. And that might make me a better physician here at home once I'm done with residency. Okay, sign me up. So I was pretty excited to participate in the global health track of the residency program here at UC. I had some field experiences in, I see somebody's in the waiting room. Do I need to admit, or can you all admit those folks on your end?
We'll be taking care of that.
Okay, good. I was excited to have some field experiences in Honduras and El Salvador leading teams. And the third and final year of my residency program, this is May of 2003, right before graduating residency, I got the opportunity to take what I had learned in Honduras and Central America countries and apply that model of global health that I had learned at UC and take it to the motherland, as we call it. I'd always wanted to go to Africa, never had the chance, but I plopped down in Tanzania, ready to save lives and change the world. There's Tanzania. My team flies into Nairobi, Kenya, the country just kind of northeast of Tanzania. We drive due west to Tanzania, and I was so excited to go there by myself for a month. And I worked in this place, Sharati KMT Hospital. And this is May of 2003. At the time, it was one of 2 hospitals serving 500,000 people. They sometimes have running water, sometimes don't. Sometimes have electricity, sometimes don't. They sometimes have medicines and drugs and antibiotics, and sometimes they don't. But what I was impressed with most was that despite what they might not have, they always had a desire to close healthcare gaps, to address inequities in healthcare from the rural to the urban areas, and just do whatever they could with the resources that they had at the time to save lives. So here I am working at this facility in what many people would call the third world, very rural area, very poor area. And I thought that my medical training, my Western medical training, was going to make me a superstar capable of really just improving people's lives left and right. So I'm stationed in the outpatient department, the OPD as they call it. And the first patient that they brought to me had already passed away. She was a lady like this lady who was a pregnant mother of several children and was trying to walk about 8 hours while hemorrhaging in labor to get from her remote village to the hospital where I was. And by the time she was brought to me on a bicycle, she had passed away and was, already starting to get stiff. And that experience completely turned my view of my purpose in life, my purpose in global health, and my ability to address health inequities upside down. I realized very quickly with that first patient, and then with the several hundred patients that I saw that first week and the several thousand patients that I ended up seeing by the time my month was up, I learned that global health and health inequities, it's tough to really make a difference as one person. And I know that you are all eager go-getters. You've, you're in the middle of your training, undergraduate training at UC, and you're in this group, which is great, and you're probably learning a lot. But if there's one message that I could share with you today about health inequities across the globe, it's that you really need to foster a sense of collaboration, unity, and partnership if you really want to affect any meaningful change. And more on that in a minute. So I finished the month, came back to the US and graduated residency, and now I'm a full-fledged physician, done with my training, and I started working for what became UC Health. And the pull to go back to Tanzania kept growing in me like a fire. I had thought that I was going to spend my 3 years of residency doing cool stuff, getting that stipend to travel the world, and it was going to be great. And I was going to come back a better doctor, more empathetic doctor, more socially conscious doctor, but that global health would fall by the wayside. But that's not what God had planned for me. That fire to go back to Tanzania, and hopefully some of you, I can't see everybody on the call. Maybe some of you have been to Tanzania with me or with my team, but if you haven't, I hope that some of you go. And if you do go to Tanzania and work with Village Life, I assure you that it will be hard to turn your back once the experience is over and not want to go back. My first month by myself, I got the privilege of working with Dr. Esther Kawira. She's a U.S. trained family physician from Goshen, Indiana, who's been living and working in Tanzania for over 30 years. She speaks fluent Swahili, and she is the guru of Burkitt's lymphoma treatment in all of East Africa. I worked with the guy in the bottom right, Dr. Jongo Machagi, and I learned more about health inequities in that month that I had learned in all 4 years of medical school and all 3 years of residency up until that time. Burkitt's lymphoma is a childhood cancer that creates large tumors in kids' faces, in their abdomens, and you can see a picture there in the bottom left. And Dr. Esther Kawira, she's like, the genius of treating and diagnosing this condition. She saves lives every single day in terms of Burkitt's lymphoma and her other work that she does. So here I am back in Cincinnati working in my practice. I'm a family doc, so we see patients from the very old to the very young. But that pull to go back to Tanzania and see patients over there stayed with me, and I couldn't get away with it, get away from it. I eventually took a position at UC in the College of Medicine as assistant dean, where my role was essentially recruiting and retaining underrepresented minorities. And I loved that work, but man, I really wanted to take students from UC over to Tanzania and see if they could experience just a sliver of that life-changing experience that I had in May of 2003. So with all of that going on in my head and in my heart, I started Village Life Outreach Project. We were officially incorporated in 2004 as a nonprofit organization based in Cincinnati, whose mission is to unite communities to promote life, health, and education. So everything that we do kind of falls in one of those three buckets. We work with partner communities to improve people's lives, to make them healthier, and to give them increased opportunities for education. It all sounds well and good, but it is hard work. We are talking about people who are living in the extremes of poverty, people that are living on less than $1 a day, people that are living in mud huts with no access to electricity, no running water. We're talking about a 12 to 15% HIV infection rate. We're talking about families that have children and don't expect that all their children are going to live. It's a natural occurrence. It's more abnormal for children to live than it is to die in a lot of these families. And I used to say that before I had kids back in 2014 when I had my first child, Grace. And it used to mean something to me, but now that I have two small girls, it means even more. And by the way, that's why I was late. that's another story. Thank you for your patience with me. Despite the overwhelming poverty and the fact that many children die before the age of 5, the ones that survive, man, they are something to behold. There is a generosity of spirit in the Tanzanian people that is one of the main draws for me to keep going back. There's a sense of community. Their measure of wealth in the society in which we work and partner with is not how much money do you have or how big is your hut. It is, what are you doing for your neighbor? What are you doing in your community to make your community better? And if you are doing something, that makes you a rock star. That makes you eligible to be selected onto the village council leadership. That makes people want to be around you. That makes people bring you gifts and presents and waive fees for this or that. And that's really how you elevate your status in the society, is by taking care of those around you. Dr. Esther and her family and friends, when they knew that I wanted to go back and was planning this trip for Village Life, our first trip in October of 2004, they felt a need to organize themselves and to have a Tanzanian sister organization that could work with Village Life to cut all the red tape, to help us with visas and to build community relationships and to get all the things done on the ground that we wanted to do in partnership with our communities. And they set up tours for us in 3 villages, Roche, Nyambogo, and Berere. And this is going to emphasize a little bit of my main point about needing to do things in the realm of health equity in partnership with other people. It would have been very easy for Village Life on our first trip in October of 2004 to sit down with these communities that our sister organization Shed introduced us to and tell them what we wanted to do and tell them how we could help them solve their problems. And that is, unfortunately, a way that many people engage in health equity work, whether it's globally or locally. People enter a community, think that their training makes them better or more knowledgeable than the people that they're going in to help, and they come into these communities as outsiders, but thinking that they run the show. And it is one of the biggest mistakes, in my opinion, that you can possibly make. What I learned from my training in UC's residency global health track was it's better to go into a community that you're going to be working with or that you want to help with your hands in your pockets rather than being burdened with handouts that you give to people. Put your hands in your pockets and force yourself to listen. Because if you are willing to listen, you will most likely hear that no matter what the level of education of people that you're trying to work with, they have a better understanding of their health problems and how to solve them as a community effort than you probably do. And that is something that you have to experience to really truly understand. But I hope that you'll trust my 16, 17 years of experience, not just in global health, but in local health equity work as well, serving on the Cincinnati Board of Health, seeing patients in one of the 2 mission practices for UC Health, where we have a high percentage of indigent patients. It really does make a difference when you listen to people and view them as equal partners. Village Life's mission isn't just going in and serving people in Tanzania, it's learning from them, learning lessons of community, learning lessons of loving one's neighbor. This is one of my favorite meetings. When students come to Tanzania with me, they like to do the work. They all want to change the world, right? Save lives. They want to get engaged in this water project with Engineers Without Borders. They want to help build this school building. They want to see patients with attendings and with faculty members from medicine, nursing, pharmacy, allied health. Every once in a while, a student will ask to tag along with me, not knowing what they're in for. Because what I'm doing while everybody else is doing all of the work, quote unquote, is I'm sitting with Village Life leadership in power meetings with the communities that we serve and our volunteers in those communities that work with us. And I'm having hour-long meetings, many hour-long meetings. They probably last an hour, but we have to translate them in 3 languages, English, Swahili, and the mother tongue of Luo, the same tribe as Barack Obama's father. And so you will typically see me in Tanzania sitting and listening to the other folks tell me their views of what we can do to work together to solve problems. What it looks like is that we establish committees. We have a life committee or water committee here in the United States that works hand in hand with a life committee or water committee in Tanzania, in each of our 3 partner villages. And this is what we try to do. We try to solve problems together in partnership. And this is what it looks like. You see these little kids, very, very young, not even potty trained by the looks of it, since they don't have on pants. Their day typically starts by walking a very long distance, sometimes up to an hour, to get water, usually from a dirty water source that if they don't treat the water is going to cause them to get sick and potentially even die. It's a big problem. So what does Village Life do? We work with the communities. This is former UC students Sarah Pumphrey and Ellie Dixon, who designed a master's thesis project to look at water filtration and sanitation. We worked with UC's chapter of Engineers Without Borders to install gutters on the roofs of the school buildings to collect rainwater, put it in this tank, and then purify it so the kids would have access to clean water at school. We've dug latrines to clean up the groundwater, drilled wells and connected them to distribution systems. Are there any? Well, I can't see everybody, so I can't ask for a show of hands, but I'm hoping that there are some EWB superstars on this call. Engineers Without Borders. It's one of Village Life's main partners here in the United States, and these are students, your peers and colleagues that are changing the world, not by themselves, but by working together with other people. And when you talk about folks in Tanzania who, for the first time, have access to clean, drinkable water from a well that you, in partnership with them, have drilled, it is quite a sight to behold. This is the day that we first struck water for our first well. And you would have thought that it was oil, you know, the way that the people were so happy. And now instead of walking for miles to get to those dirty water sources, they can just go around the corner to their own local tap stand and access clean water. UC students putting classroom activities and equations to work with people to solve major, major problems. And it's a sight to behold. We also work obviously in healthcare. And I talked a lot about water because another learning lesson with health equity is you need to really be thinking about the social determinants of health. And if you haven't heard that term before, please look it up. It means that healthcare oftentimes is much bigger. I won't even say oftentimes, I'll say always, is much bigger than just sickness and disease and medicine and treatment. You have to really be thinking about the whole total package, people's access to clean water, people's access to transportation, housing, food, agriculture, education, employment. All of those things can dictate how healthy a population is or not. And it's real life. You know, many people, I show this picture not to scare you, but to just emphasize that we are very fortunate to live in the country that we live in, to live in the communities that we live in, and not to have to face poverty like this each and every day. But there are millions and millions and millions of people around the world who this is their everyday. And so how do you solve problems like that? You work together with communities and bring over healthcare experts, but also train locals to become doctors, nurses, nurse midwives. And it's a really cool thing to behold, whether you're fighting malaria through distributing mosquito nets or working with communities and bringing specialists and trying to educate and learn from healthcare experts in Tanzania. It's a pretty cool thing when you can do it and do it right in a way that speaks to partnership and community building. And I realize that we have limited time. One of Village Life's signature projects was building a health center in Tanzania that opened in 2011. And it started with a partnership between former UC architect Michael Zaretsky and the chairman of Roche Village, Alfred Chacha, and the corresponding communities. And Professor Zaretsky taught some graduate level studio courses in architecture, and then sent one student, Emily Rausch, pictured in the middle, over to Tanzania, not to build the health center for the community, but to train, for the most part, unskilled laborers how to build their own community health center so that they would learn lessons of enhanced construction, safer building and design, and be able to build with no electricity, no power tools, no nothing other than hand tools and sweat and you know, equity, build their own health center with a little bit of support from my clinical employer, UC Health, big fat check. And that's Roche Health Center, so that women no longer have to travel 8 hours walking and lose their lives along the way while hemorrhaging in labor. They can go around the corner to their own local health facility that their own community built and receive life-saving treatment and care for them and their families. Uhuru na Umoja. It's the Tanzanian motto, and it says freedom and unity, which is quite similar actually to UC's motto, Junta Juvent, strength and unity. But this is my favorite Village Life picture. This is the first baby born at Roche Health Center. And again, this was not an individual effort. This was a collective, collaborative effort. And I think if there's one thing that I could leave you with, it's the importance of thinking about health equities as a community effort, as a global effort, and as an effort that requires you to dig deep into your own psyche, into your own mind and your own heart, and figure out, why are you interested in this work? Why are you doing this work? Is it for accolades? Is it for position? Is it for income? Is it to do something cool? Is it because you care? Whatever the reason, I think constant evaluation of where you are on your journey, starting from completely selfish to, you know, Martin Luther King, I have a dream. Where are you on that spectrum? Where are you on that educational journey? And what steps can you take to get further on that journey. Adam, I can't remember. How much time do I have?
You have till 1:35, but if you have a couple more points that you'd love to bring up, there's no rush really.
I don't think so. I think I'm gonna try to unshare. I'd certainly have more content. Am I unsharing now?
Yeah,
Okay.
yeah, you're good.
Now I see all of your beautiful faces.
Yeah.
Another point, was that 135? Was that including Q&A, or do we have time for a couple of questions if there are any?
Yeah, we have 10 minutes allotted for Q&A, so
Okay.
yeah, so like feel free to just put your name in the chat and then I'll call on you and then you can just unmute yourself and ask a question. But thank you so much, Dr. Lewis.